Yesterday, the government pledged an extra £50 million for dentists to provide additional urgent care for NHS patients. Maria Caulfield is the MP for Lewis and Minister for Patient Safety and Primary Care, and can tell us more. A very good morning to you, Maria. Just explain this contract system then, because I don't think a lot of people really understand it or even know about it.
Yeah, so basically, dentists are not directly employed by the NHS. They're independent providers, and so you'll get many practices that do a range of NHS provision, but also do, private cosmetic work or private dentistry. And so if dentists don't want to do an NHS contract, they don't have to. And the contract itself actually is a disincentive to take on NHS work. So they're paid per unit of dental activity. And if you go and have a visit and you need 3 fillings and a crown done, they will get paid 1 unit of dental activity. And if you only need a little bit of a work, a small filling, they'll get paid the same amount.
What?
So for more complex cases, there's a real disincentive to take
massively. I'm no expert, Maria, but that doesn't make sense to me at all. Who came up with that plan?
So this is a contract that came in 2006. And, when I looked at this, I've only been in post a few weeks. And when I looked at this, it was clearly not sustainable. And so we're in discussions right now with the BDA, so the British Dental Association, about urgent contract reform. So we do have the impact of COVID. Undoubtedly, there's a huge backlog due to that. But unless we deal with the contract issue, then dentists are not going to feel valued for the work that they're doing, and they're not going to be properly paid either. So, there's a whole, the contract itself is probably the single biggest reason that dentists are not taking on NHS work.
Yeah. The other issue, though, which was raised earlier by one of our guests, it's all very well saying, OK, we're going to give, £50 million cash boost, encourage dentists to do appointments out of normal hours, so evenings and weekends. But more than one guest, in fact, has said, is that going to happen, though? You're talking about people who are really stressed out. Do you know what I mean? That they've been working through the pandemic. They don't want to work extra hours.
So we do have dentists that currently aren't doing NHS work, who, if the incentive was right, and with the £50 million, they will be being paid a higher rate than they currently are in the existing contract. And if they have the capacity and they want to take this on, then the funding is there to enable them to do so. And so we don't necessarily have a shortage of dentists in this country. We have a shortage of dentists wanting to do NHS work, and the contract is the real crux of the matter there. So this £50 million will try and encourage those who maybe aren't doing NHS work or are doing a little bit of NHS work and would like to take on some more, but the contract's not really encouraging them to do so, that this £50 million will increase that capacity. So we're not asking dentists who are already at capacity to do extra longer hours. We're just trying to get more dentists interested in taking on NHS work.
And will there be more funding up the line if needed?
Yeah, for sure. that's part of my role, is to go and lobby the Treasury to say, for funding. And that's what we're working on at the moment. There is no doubt that unlike most of the NHS that's having record levels of funding, dentistry hasn't seen that same level of investment. And I'm responsible for all primary care, so GPs, pharmacists and dentists. And I'm really clear that we need to reform the contract and look at the investment that's going in there. There is investment going in. We're doing some really great work in terms of oral health prevention. So things like fluoridation of water, improving, education of children with teeth brushing in schools. But we absolutely need to look at the sector as a whole. And they're the discussions I'm having about the long-term funding settlements for dentistry, in the next 3 or 4 years.
Because it just doesn't seem fair, does it? Listen to some of the stories we've heard this morning, that people should be in pain because they simply haven't got enough money in their bank account.
Yeah, no, absolutely. And, during the pandemic, urgent appointments were still continuing. But what happened is those people who didn't have urgent problems, obviously they've been waiting, 18 months, 2 years, and those problems don't go away. They become more urgent. Yeah. They absolutely do. And so now we are, dentists are allowed to open back up to around 85% of normal activity. Some of that backlog will start to clear. And you're already hearing from your listeners that it's getting easier to get appointments, but there's a huge backlog of patients, and that's why we've announced the funding to try and get through as many patients as possible in the short term, with that contract review in mind, so that we've got a long-term sustainable solution so that dentists feel valued and want to take on NHS work.